Walk into almost any allied health clinic before the first appointment, and the treatment rooms look immaculate. But zooming in on the vinyl surface of a treatment table reveals the biological reality: sweat, skin cells, and microscopic pathogens left behind from yesterday's patients. This creates a dangerous trap for practice managers. Relying on a standard commercial cleaner to empty bins and vacuum the waiting room creates a false sense of security, while the clinical surfaces remain contaminated. Look at these office chat logs praising a space as clean and organized. That standard is fine for a corporate office, but it is insufficient for a medical audit. Regulators do not care how tidy your reception desk looks. Enforcement bodies like SafeWork, NSW, and APRA now evaluate clinical spaces against strict biological standards, specifically AS 5369-2023. They expect documented proof of infection control protocols, not just a dusted room. This leaves practice managers in a tough spot. Hiring a generic commercial cleaning crew means spending thousands of dollars a year while remaining entirely legally exposed if an infection occurs. In a physiotherapy or podiatry clinic, visual cleanliness is no guarantee of biological or legal safety. You need verified protocols to protect your patients and practice. The Spalding classification system is the mandatory framework for managing this risk. It dictates how you treat different zones in your clinic by dividing spaces into non-critical, semi-critical, and critical risk areas based on the potential for infection. This matrix outlines the contrast. Left, standard generic tasks: vacuuming, wiping desks, and emptying rubbish. Compare that to the legal reality on the right under AS 5369, utilizing TGA-registered disinfectants, conducting mathematical surface validation, and running spore-tested autoclaves. Adopting the Spalding framework integrates cleaning directly into the practice's risk management strategy, ensuring every dollar spent aligns with specific infection control requirements. Consider your semi-critical spaces, like a physiotherapy treatment room. The vinyl tables require precise attention between every single appointment, not just at the end of a shift. The protocol dictates a wipe-down using a TGA-registered intermediate-level disinfectant. To be legally effective, the solution must remain visibly wet on the surface for exactly 30 seconds. Achieving the validated destruction of pathogens like MRSA adds 2 to 3 non-billable minutes to each consultation. This requires deliberate adjustments to your daily booking schedule to remain compliant. There is also an equipment maintenance trade-off. While household bleach is cheap, it strips medical upholstery and creates micro-tears where bacteria thrive. Specialized enzymatic foam cleaners are required to safely lift organic matter. Using the correct chemicals yields a significant financial return. Proper maintenance protocols extend the lifespan of expensive vinyl tables and hydraulic podiatry chairs from 4 years up to a full decade of use. This requires strict staff training because chemical inventory management is hazardous. Mixing bleach with common ammonia-based cleaners creates a toxic gas, while combining quaternary ammonium with standard detergents neutralizes the disinfectant entirely. Protecting high-value medical assets and ensuring patient safety requires precise handling of chemical agents. Generic janitorial supplies cannot meet these technical demands. The stakes escalate in practices that perform invasive procedures.
When a podiatrist removes a skin lesion or a physiotherapist utilizes dry needling, instruments break the skin, introducing the risk of bloodborne pathogens. Under the Spalding matrix, these procedures move those spaces and instruments into the critical risk row, triggering mandatory sterilization requirements. AS 5369 mandates a strict automated reprocessing pipeline. Instruments must undergo an enzymatic pre-clean, run through a thermal washer, pass visual inspection under magnification, enter a steam autoclave, and move to documented storage. Running this pipeline requires massive resource inputs. You face high capital expenditures to purchase Class B steam autoclaves, alongside the ongoing operational costs of conducting and recording weekly biological spore tests. The outcome of this bottleneck is comprehensive security. A perfectly executed and logged sterilization cycle provides documented protection against patient infection liability and APRA breach notifications. If your practice breaks the skin, strict adherence to these sterilization standards is a non-negotiable operational cost. If an inspector from SafeWork walks into your clinic tomorrow, how do you actually prove your surfaces are safe? Trusting the night cleaner's signature on a checklist holds no legal weight.
This meter provides the answer. ATP bioluminescence testing measures residual organic matter left on surfaces, giving you a clear, mathematical reading of biological cleanliness. Implementing this system requires a trade-off. It costs roughly $500 to acquire the meter, and mandating a monthly swabbing routine consumes valuable staff time. But the data it produces is invaluable. Consistently low RLU readings serve as mathematical proof of your hygiene standards, forming a documentary defense during any compliance investigation. Introducing mathematical validation immediately exposes the flaws of a cheap cleaning service. When the SWOT fails, it indicates that the current contractor likely lacks an understanding of contact times and pathogen removal. To determine what level of service you need, we can look at this flowchart mapping clinical risk profiles to operational actions. The first major fork in your decision is assessing your clinical offerings. Do your practitioners process reusable instruments or perform minor procedures? If the answer is no, a low-risk physiotherapy clinic may handle daily terminal cleans internally, provided staff document their use of TGA-approved disinfectants. If yes, multidisciplinary centers or podiatry surgeries must utilize specialized clinical cleaners to meet the intensive demands of AS 5369. A standard commercial janitor targets visible dirt. A specialized medical cleaner targets legal liability through validated compliance. Getting this wrong carries severe operational consequences. Poor protocols lead directly to ruined hydraulic equipment, massive WHS fines, and preventable patient harm. Weighed against those risks, paying a higher monthly retainer for a compliant medical cleaning partner becomes a logical investment rather than a painful expense. Specialized commercial teams deliver the chemical logs, verified checklists, and continuous audit trails that health regulators actively demand. Attempting to take shortcuts on your cleaning contracts directly undermines the medical authority and safety of your practice. Your clinic is a highly regulated medical space. Your operational budget, your chemical selection, and your audit logs must reflect that reality.